Hello, I'm Dr. Warren, and I want to run through a reason why Lyme treatments fail, and specifically why antibiotics become less effective when dealing with chronic Lyme. This is a question that I get repeatedly with kind of the inference of, well, why doesn't the recommended 2 to 4 weeks of antibiotics just cure everyone? So let's just dive in so you can understand what a better strategy might be for someone who's failed your normal course of antibiotics and why that may not work for everyone. First off, just know the general guidelines that the CDC recommends are 2 weeks of antibiotics, usually just doxycycline, a single antibiotic. For the rash, if you have neurological symptoms, they recommend 3 weeks. And if you have arthritis or pain, they recommend 4 weeks. Also note that the doctor has the leeway to do this protocol once and has the leeway to do it a second time. So this can be repeated if you get partial improvement but not full improvement. And that's about as far as standard recommendations go. After you've done that standard protocol 1 or 2 times, then the doctor is just told just do medications for symptoms. So if you have headaches or pain, they'll do painkillers, or if you have anxiety, they'll do anti-anxiety meds, or if you have neuropathy, they'll do gabapentin. So they're taught do the standard protocol 1, you can kind of flex it to 2 times, and then just start doing medications to cover up symptoms. That's really what is the standard protocol. I think it's very inadequate, but that is kind of what the protocol is. We went through a video last time where Johns Hopkins went through how many people develop chronic Lyme. And in people who got antibiotics in the first 30 days, they found there's about a 10% failure rate. So about 10% of people who get Lyme are going to have chronic long-term problems. Those are pain, fatigue, and abnormal neurological problems. And this was in patients who got the standard antibiotic treatment. Now, they also say it's likely higher. They say maybe 20 to 30% fail rate in people who do not get the antibiotics right away. I would say this is a guess in the study. They really just studied people who got the antibiotics right away. We know it's going to be a higher fail rate the longer we get the antibiotics. I think once we've missed it beyond 3 or so months, the success goes down dramatically, and I'll show you why in a moment with a picture. Now, before I move on to why it fails, we want to cover that in this study, they said that this really affects your life. They said that the findings between people who had chronic symptoms from Lyme was that it significantly impacted your life. It impacts your family life. It impacts your work life. So the pain, the fatigue, the neurological problems are severe enough to where they're impacting life. Now, this is a big deal because they generally are not deadly. We're outside of that acute phase, dangerous phase when we're dealing with chronic Lyme, but the symptoms are severe enough to dramatically affect your life. Why don't the antibiotics work? We've kind of gone through other things where we go, here's the problem, but I haven't really delved into why explicitly. Why don't the antibiotics work like magic, like they do in so many other diseases? What's different about Lyme than like strep or other diseases that we've really conquered with the advent of antibiotics? This is a picture that I think best explains that Lyme is actually able to change phases. Now you'll see pictures here. In A, there's a log phase, which is the normal phase where it's actually a spirochete is the type of bacteria that Lyme is. But in this log phase, this is actually where antibiotics have the most success. And this is the type of bacteria when you first get bit that this is the form the bacteria is in. But literally after it's been in you for several months, about 3, can be different in every person, it forms these macrocolonies. What they're labeling here is microcolonies. But they're biofilm clusters, and this biofilm protects the bacteria, makes it much more resistant to antibiotic treatment. Also, there's a stationary phase where the Lyme gets into a form that is not as long, it's a little more dot-like, but what happens is basically it slows down. And I think of this like getting on and off a subway, there's just this certain buzz of activity with people moving. And what happens is as the metabolism and as the life cycle slows down, then it becomes much harder to intercept and kill because it's just not as metabolically active. What happens here in this study is they actually show pictures of how effective different antibiotics are against things in these different forms. While the stationary form of bacteria is probably not as familiar, the biofilm form is actually extremely familiar to you because of dentists. Plaque on your teeth is a great example of a biofilm that's actually protecting bacteria. And the issue with the biofilm is that you can't penetrate through it to deliver the antibiotic to kill the bug. And that's where your dentist uses the ultrasonic waves, or they'll use the pick to help break up that biofilm so they can clean the teeth. When this happens inside your body, Lyme is protected by this biofilm. And so it's about getting through that biofilm to actually be able to access the bacteria where it is. This is just a graph. What you're going to see here is the red bars is the residual. This is looking at residual viability. When it's in the log form, which is the regular form, the antibiotics can help bring Lyme down to low levels. Then your immune system can take over. And what you see with the really high green and purple bars is once it's in this biofilm form, once it's in this stationary form, the effectiveness of the antibiotics goes down dramatically. You'll see like doxycycline, which is the standard antibiotic that everyone's given, there is still 80-ish% of the bacteria left alive after you try to kill it with doxycycline. Whereas if you try to kill it when it's in the susceptible form, there's only 30% left. So it's killing so much more if you're catching it early, not 100%, but it's killing so much more effectively than it is once the bug's in these later phases. And once the bug is in these later phases, we're going to need other things to help kill it. Now, this is time for other studies, and we have other blog articles and videos where I go through some different studies. But 2017, 18, and 2020, Johns Hopkins has published articles where they're showing they're growing the stationary form of Lyme disease, and they're using different antibiotic control groups, and they've studied 80 plus different herbs, and they found things like oregano and clove and cinnamon and skullcap and knotweed and crypto and other herbs that have been very effective at helping to get rid of Lyme when it's in this stationary form. Also, we found that things like oregano and clove and cinnamon work wonders to get through this biofilm, which is protecting Lyme. It's for studies like these that I believe patients get better results when using some of these natural options because they're more effective at helping fight the bacteria once it's in these other phases that are not as well serviced by some of the traditional antibiotics. And this is why I think you see this failure rate and a higher failure rate in people who have not gotten antibiotics in that early phase. We could help eliminate many suffering people by being better and faster at identifying Lyme. This is a huge push in the medical community, but also realizing that even if we got everybody antibiotics right away in that first 30 days, Johns Hopkins is still saying we'd have a 10% people break through. And that's just a lot of people. Minnesota has 50,000 cases of Lyme disease every year. And a 10% fail rate means 5,000 Minnesotans year after year after year after year are kind of slipping through the cracks of the current medical system. That's only in Minnesota. Same numbers, very similar numbers in Wisconsin. So in the Midwest, you're looking at 10, maybe 12,000 people a year. And those are the conservative estimates if everyone got proper treatment. And unfortunately, so many people who I run into did not receive treatment for months or years after their bite. It just wasn't recognized, especially if it doesn't show up as that traditional rash and traditional arthritis. I hope this was helpful in helping you understand why the bacteria are less responsive to antibiotics and slower responsive, because they've literally changed form from that spirochete normal form into these biofilm forms and these stationary forms. And we need to take different approaches in order to help eliminate them. Now, Johns Hopkins doesn't stop there. They really recommend that it's not only about attacking and killing the bug, but this threefold strategy that we really employ and really preach is you need stuff that helps kill Lyme and these co-infections, not just in the regular form, but also in these stationary forms and in these biofilm forms like we've talked about today. But just that still isn't enough. You want to be doing things to help your immune system. Remember, your immune system is trying to fight the bug. We want to be helping your immune system to be strong and functional to eliminate this bug, especially because that's what has to finish the job for you so you can be well in the long term. And then lastly, this war between your immune system and the bug causes damage to the body, and we want to repair that damage. So some symptoms come from the bug. Some symptoms come from your immune system fighting the bug, and then some symptoms come from your body just breaking down over the fight. And in order to get the best results, you want to be doing some fighting the bugs, some helping your immune system, and repairing your body. We really need to do all three things to get the best results. I'm Dr. Warren. Hope you found this useful. Thank you.